So it's not just medication. We need to give good energy to our body, but sometimes they just tell us, eat healthy. What does that even mean, eating healthy? So for that, we have Dr. Rafael Lopez Urdiales. He's an endocrinologist with a specialty in nutrition. He's local from the Bellvitge Hospital. So with no further ado, I'll give the podium to him. Thank you.
Hello, everyone. Thank you for having me, for still sticking around. You probably know what Erdheim-Chester Disease is, maybe probably better than us or than most medical doctors. And I think that in the next slide, most people, everybody knows that it's important, but maybe you don't think that much about it, and especially here in big hospitals. There is no life without nutrition. Every person's life depends on being well-nourished, mostly if this person has a chronic disease, such as Erdheim-Chester's. Well, there's been an extensive talk about what it is and how it affects many organs in the body, and the inflammatory process behind it, which is key to what you can do with nutritional therapy. There's also the prevalence is very low and very unknown, and some of the scientists down there could speak much more about it than myself. Why nutrition matters in Erdheim-Chester disease? There is no specific Erdheim-Chester disease, but the proper nutrition plays a vital supporting role. Why? It improves immune function, it helps recovery, and it helps healing of wounds or of any disease that the patient may have. It's also really important to treatment support managing side effects of medications, which has been extensively covered before too, and the risk of complications related to the medication and not only to the effects of the disease. And it also improves the quality of life, which is an essential point to be taken care of. There's also a big issue with weight control, both excess weight or loss of weight. There are new medications that we have for weight control, and that's a huge field of interest, and it could give room to a lot of talk about it. And there's also one thing that needs to be taken into account, mostly in elder people or people with neurological issues, which is dysphagia, which could also be the subject for another talk. And one of the most important things is that nutrition can help modulate inflammation and support metabolic health, and that's why it's important in this kind of diseases. The nutrition should be based in its anti-inflammatory effects and also in an adequate provision of protein to help maintain the muscle mass, as the doctor before me talked about. There should be plenty of, it should mostly be based on plant-based foods. And it's also an important thing to have different colors in your plate. It shows that these foods, these vegetables, they're different. They have different colors. They are rich in polyphenols, antioxidants, and they reduce inflammatory markers. They're also very important omega-3 rich foods. They're also very important to control, to modulate inflammation. It's also very important to have complex carbohydrates. Lots of people with chronic diseases, or if they're being treated with glucocorticoids, they have a higher risk of diabetes mellitus, and and it's important for them to have more complex carbohydrates to help maintain stable sugar blood levels, and also with higher, this combination of all these things we're talking about means that the diet has to be rich in fibers, so both soluble and insoluble, to help have a healthy gut, which is also related to the microbiome, which we won't be talking about, but there's a lot of science behind it. There should be limited, and this applies to everybody, highly processed foods, added sugars, refined carbohydrates. They contribute to the systemic inflammation and metabolic stress. And there's also a very important thing to be taken into account is that you have to adapt your diet depending on your specific organ involvement. It's not the same if you have kidney failure or if you don't, that you have to change the nutritional advice you have to give to the patients and to their families. More examples of what could be this healthy diet: berries, different fruits, and this kind of red fruits, blackberries, strawberries, you name it, all kind of berries. They're good. They can also be added to different foods, for example, yogurt or kefir, and they have a probiotic effect. And before seeing in the scientific articles that was a good thing to do, that's one thing that I usually do every morning for myself. Leafy greens, they're quite good to provide these antioxidants that we were talking about, and they can be added to many meals that you prepare. They can also, both berries, leafy greens, they can also blend it into smoothies, which may be easier to drink, and especially if you have dysphagia, as we mentioned before. Healthy fats. Not all fats are created equal. Not all fats are the devil. Extra virgin oil, and here in Barcelona, we're in a great place to talk about the importance of Mediterranean diet, and the Predimed study, which proved the cardiovascular benefits of Mediterranean diet. It should also have nuts, walnuts, different almonds, all of them. They're very good. You should also use olive oil, especially if it's extra virgin, as a primary cooking oil. It's easier said than done. Here in Spain, it's not that expensive, but it's also quite expensive, and it's been increasing the price. But it's probably a better fat to use to cook. And avocado is also a very interesting food to have because it's very rich in fats, but they're healthy fats. And also fatty fish, mostly the blue fish. Mackerel, we mentioned before, salmon, tuna. You should have a few servings every week. And also a good option is having canned options. It could be very convenient. We'll talk about it a bit more later. And also a very important point, and there was a question this morning about it, is hydration. It's essential, particularly critical if kidney involvement, or, as it's also been said, diabetes insipidus or insufficient antidiuretic hormone. There should be at least 8-10 cups fluid a day. You can use just not water. You can use infusion, herbal teas, naturally flavored waters, such as with a few mint leaves or a few drops of lemon juice. You should limit or avoid alcohol. On caffeine, I think it's not a solved issue, but maybe 2-3 cups of coffee every day. Mostly, it's recommended not to drink it too late, so you won't be too awake in the night. And another thing that you have to take care in some patients is of dysphagia, maybe the need of thickeners for liquids. Now, another very important thing is bone health support. Skeletal system affection is very common in Erdheim-Chester disease. Then you have to have enough supply of calcium, vitamin D, and you could have to supplement, so you may need supplementation with your healthcare team of this or any other nutrients you may need. And that's something you have to consult with your healthcare team. More about that later. And there has to be an individualization plan. It's not a one-size-fits-all, as my colleague said before. you have to develop a personalized plan, consult your team, medical, a registered dietitian may have a very important role in managing a patient with chronic disease and especially with Erdheim-Chester disease, and it also depends on what organs have been affected. And, but any change you do, it's good. It's good if you have interest and you do some research or you ask other patients, another family patient, or another caregivers of patients. But you have to discuss your changes, the changes you have to do or you want to do with your healthcare team, because they may interact with the medication or affect different organs, and it's something that you shouldn't do by yourself. It should be part of a medical team which knows your case and knows what to do. And maybe you have to be referred to a registered dietitian or a medical doctor specialized in nutrition. It's not just one doctor covering each possible issue of this disease. So a few practical tips on addressing challenges in everyday nutrition. It should be a good thing to do for everyone, including myself, is batch cooking healthy meals. You have to make time on probably in the weekend, if you have more time, not just prepare the food for today. Make some more so you can use it during the week. You can prepare ingredients in advance. You can freeze them in little portion-sized bags. You can keep pre-cut vegetables or quick proteins such as hard-boiled eggs. They're ready for meals, or they're ready to increase your protein content, which is very important to keep your muscle mass. If you have poor appetite, as you can have in chronic diseases or in oncological diseases, it's important that you eat small, frequent meals rather than 2 or 3, or some people just eat once a day, and they just eat a little bit during the day, but they just do one big meal. And it's better if you're not feeling that hungry, it's better if you eat frequently. And also, it's important to eat when appetite is highest, not just to wait for lunchtime or to supper time, and maybe you've lost that appetite if you wait that much. There are some nutrient-dense options which may be interesting to use, like avocado, we mentioned before, solid foods. If solid foods are challenging, there can also be nut butters, which may be good to use, with moderation, of course. Family involvement, that's a very important issue. Family and social involvement is also part of the Mediterranean diet. It's not just yourself. If your family helps you and if you eat with other people, there are proved benefits with involving other people in your meals. And when do you have to seek help? If there are significant weight changes, both high or low weight. If you have persistent digestive issues, diarrhea, constipation, if you find it difficult for you to keep an adequate nutrition, or if there are symptoms interfering with your eating. So, as a conclusion, nutrition is a supportive strategy to the medical therapy. It's not an alternative. It's not as other medical metabolic diseases, which are mainly treated by diet. But the diet should be a very important pillar of the treatment. And if you have an internal environment supporting healing, it helps to manage your symptoms and your treatments to act as they should, and not to have complications related to them or make them less likely to happen. You should focus on a predominantly plant-based diet rich in whole foods with adequate protein and healthy fats. You should pay attention to how different foods affect your unique symptoms and how the energy levels you feel. Sometimes a food journal may help to identify patterns. So if sometimes some foods you don't digest them well, you can track your symptoms and what you've eaten and help to identify some patterns, and that may be useful for you. You should also request a referral to a registered dietitian that could address your specific manifestations, and there should also be regular follow-ups. It's not just, that's the way you have to eat, and you have to stick to it through all your life. So I think that should be all for myself. Please feel free to ask me anything you want later in the panel.